Aloha, everybody. It's really an honor to be here today and to work with our partner, Roots Reborn and MauiWES. My name's David Tumilowicz. I'm the Senior Director for Marketing and Community Health at Kaiser Permanente Hawaii. I know there are some folks from the continent or maybe even internationally tuning in. So if you're not familiar with Kaiser Permanente, we're a fully integrated healthcare delivery provider. We're privileged to serve a little bit over 40% of Maui residents and about 1 in 5 residents across the state of Hawaii. I think the most important thing to understand about Kaiser Permanente is that we are a mission-driven organization. The mission of Kaiser Permanente is to provide high-quality, affordable, and health coverage, healthcare. When I think about the term affordable, I think about access. We believe that everyone has the right to access high-quality health care, and we exist to improve the health of everyone in the communities that we serve, whether they're our members or not. The Lahaina wildfire was the deadliest fire in the United States in over a century. 102 people perished. Over 2,100 homes were destroyed and displacing over 12,000 people. The devastation and loss are felt even today across Hawaii. I was at a Kapolei Chamber of Commerce holiday luncheon just a couple of days ago, and the topic of the wildfire came up, and you could just feel the heartbreak in the room. As horrendous as the immediate loss of life in a disaster was, depending upon the choices that we and the community make now, it could be dwarfed by the loss of healthy years and the generational impact of the disaster in years to come. So that's why MauiWES is so important, to help us understand the health and social impact of the fire, to design the right interventions to mitigate the loss of healthy years. From day one following the fire, Kaiser Permanente has been all in on the disaster response and recovery. Our physicians and care teams were in the shelters as the first survivors began to arrive. We operated mobile health vehicles and first aid stations, providing care to all on West Maui for 8 months until community providers were able to meet demand. Our care teams worked day and night to locate our medically fragile patients, including those on dialysis, in the days and weeks following the fire. I can recall when we finally located our last dialysis patient about a week after the fire, and the joy on the team, who at that point had felt that he had surely perished. He had not. He survived. We're part of the community, and this is personal, for all of us at Kaiser Permanente. Not including the provision of care following the disaster, Kaiser Permanente's contribution to Maui's recovery now exceeds $8 million, including the implementation of the charitable health coverage plan that Vero had just talked about, and I'll discuss in a moment. Proactive medical financial assistance awards absolving all West Maui residents of any medical debt owed to Kaiser Permanente prior to the fire, and which continues for the duration of the emergency proclamation. So even today, West Maui residents not paying co-pays or co-insurance to Kaiser Permanente. And over $4.5 million in grants to community organizations to support housing, behavioral health access, healthcare workforce development, emergency feeding, and other priorities. Kaiser Permanente is also participating in important community conversations about Maui's recovery. With the Hawaii Community Foundation, Kaiser Permanente founded the Maui Recovery Funders Collaborative, which is an effort to streamline grant making and collaboration among Hawaii's largest charitable organizations. We have led a healthcare workforce development track in the Maui Economic Recovery Commission that has resulted in a grant to the Maui Economic Development Board to build a stronger pipeline for healthcare professionals. It's a critical issue. The Hawaii Rural Health Association recently found that 39% of healthcare providers on Maui are considering leaving the island following the disaster. We're actively engaged in weekly meetings with the Governor's Office on Wellness and Resilience and 30 to 50 community providers to coordinate behavioral health response to the growing need for behavioral health and substance abuse services. We've been an early funder to elevate important efforts that have now raised millions of dollars in follow-on funding from government and other donors, including the Maui Wildfire Exposure Study, but also the Kealoha Behavioral Health Resiliency Center, which is now a critical component of Maui County's long-term recovery plan to provide behavioral health support to survivors for decades to come. I know that there are a number of folks here today from the University of Hawaii. We've been partnering with the University of Hawaii's Thompson School of Social Work and funding a mental health workforce accelerator program that will develop additional behavioral health therapists for Hawaii, placing 20 master's level graduates with community-based organizations over the next 2 years with a special focus on Maui. So in other words, we are deeply invested and we stand with Maui, and we will continue our role as a funder and a partner to Maui community organizations in 2025 and beyond. I do want to just take a moment or two to walk through the Hawaii Health Access program that Vero had talked about. It is a charitable health coverage plan that we launched following the Lahaina disaster. So much of what she talked about really resonates deeply with me. The trust that Roots Reborn has with the community that they serve really resonates. We did a lot of community vaccination work with community-based organizations during COVID, and it really is true. It's a three-legged stool. We rely on the trust that community-based organizations have with the constituents that they serve, and they're essential partners to us. You know, this plan, when we launched it, did seem almost too good to be true. But recall the mission of Kaiser Permanente, which is to ensure that everyone has access to high-quality health coverage. When we launched the plan in 2024, we had room for up to 300 members to join Kaiser Permanente through the HHAP. We ended up achieving 158 members, and most of which were enrolled through Roots Reborn. These are people without access to any other form of health plan coverage. We are increasing the size of the program to 400 members on Maui for 2025, and we're also launching the program now on Oahu with the capacity to serve up to 300 members. I got an update literally just yesterday, and we are currently at a little bit over 300 folks enrolled for 2025. So the program, continues to grow nicely, with 5 weeks remaining during the open enrollment period. So I mentioned a little bit about the Hawaii Health Access Program. I think one of the things I do want to point out is that HHAP members enjoy the same access to care as all Kaiser Permanente members. We do not discriminate between commercial, Medicare, Medicaid, or HHAP members. A member is a member, and when they come into Kaiser Permanente, they receive the same level of care as any other member. We believe that everyone has the right to access high-quality health care. The way that the HHAP works is that the individual enrolls in the Kaiser Permanente 010 plan, which is an ACA plan on healthcare.gov. It's a very rich platinum plan. And then they fill out a separate application for Kaiser Permanente to pay the premium of the plan. They are not out of pocket for any costs for most services received at Kaiser Permanente. To be eligible for the plan, people cannot have access to any other form of health coverage. And there too, I think it's important to note that we knew that transition of health insurance was going to be a huge issue for people who were dislocated by the fire. Many folks have the opportunity to move on to MedQuest if they lost their commercial group coverage. And we had teams in the disaster recovery centers for months following the fire to help our members transition to MedQuest, presuming that they qualified. So cannot have access to any other form of health coverage and must have an income of under 300% of the federal poverty level. Legal status or citizenship is not a requirement, And as Vero had talked about, the HHAP is wholly supported by Kaiser Permanente without any other form of public or private funding. The open enrollment follows the open enrollment cycle on healthcare.gov for ACA plans. So we are now in the open enrollment cycle, which started on November 1 and will end on January 15th. And I think that will fill the 700 slots that we have this coming year, 400 for Maui and 300 for Oahu residents. We are deeply appreciative of our assistance organizations, so Roots Reborn for Maui and Pacific Gateway Center, and I think there may be someone from PGC here today who is helping us with the assistance for enrollment services on Oahu. And that is pretty much what I had to share with you today. I think people will get a copy of the deck, so you'll have the information if you want to refer back to it.